They have to keep showing up for these treatments, surgeries, these hormone shots. No one really thought of these people as also suffering from trauma. If we can help women see that your uterus and your fallopian tubes do not define you in this world.
You work with some of the hardest of the hard, and you help these couples. I thought I was going to lead with talking about fertility PTSD, but I just want to acknowledge you work with the whole gamut. But in working together, what I've seen in the stillbirth group that you've been leading, how they came in, they were so downtrodden in that week one. And now they are months in, they are all friends. They're like a community.
Yes.
The work that you're doing with them is outstanding.
Thank you.
Not enviable. Can't be easy.
Well, it transforms people, community, and feeling like you have a sense of meeting others going through the same journey, which is unique with stillbirth in particular. Well, all of these areas are unique, I guess. But especially when a couple undergoes a stillbirth, usually they don't know anyone else who's had a stillbirth. And they can feel very alone and isolated in their experience. And depending on families and communities and friends, they tend not to really understand the trauma that has created in this couple, and how to support them, how to listen to them, how to be there for them. Some people just disappear. They don't show up. And others might show up, but no, it's really awkward. A lot of platitudes happen. Or they just don't feel seen and heard. It's like a momentary thing. Like, we're so sorry this happened, and then they never talk about it again with them. They don't know how to navigate, and it's partly our culture's fault, or mainly, I should say, that we don't know how to talk about death and grief in our culture. We're really grief illiterate. And we're scared of death, although we're all going to die. So, and sadly, when it's an out of order death, like a baby, it's even more taboo-ish, I guess, to talk about. People are really scared that maybe that'll happen to them, or they don't want to upset the couple, so they tend not to want to talk about it. Which is the exact opposite of what this couple needs. This couple needs acknowledgement. They want their friends and family to say the baby's name, and it helps them feel acknowledged and seen for what they've been through.
Yeah. Well, as far as the episode goes, that's intense to start with, but I am seeing it with my own eyes of they are laughing.
Yeah.
They are friends.
Yes.
And you cannot deny that they've been transformed. And I want to come back to that group later in the conversation. So, yes, death and dying and grief and loss. What would be your introduction into this field?
Yeah, well, my life path, yes, has not been easy, whatever karmic thing I've chosen here. My father died when I was 15 of suicide. My girlfriend a year later of suicide in high school. And then at 24, my husband died in a car accident. And it was at that time when I was working in film and television, actually, for Warner Brothers, that I decided I need to go back to school. I want to figure out what's going on psychologically. I've always loved psychology anyway, but I wanted to somehow marry the two of my art and artistic background with psychology. So I left Warner Brothers and went back to school, and I really haven't looked back. I really, really found my passion in psychology, and I love learning. I'm constantly learning. I mean, there's so many things.
You are insatiably learning.
I really am insatiable. I'm even in school now, getting an advanced degree in hypnotherapy. And hypnosis has been an amazing tool for trauma and for people needing to heal their past wounds from a younger place inside them. And it's a real thing. So to take someone back in time to a younger version of themselves and to heal that. It's so powerful. And then how that transforms them even in their life going forward. It's like having 5 talk sessions in one session. It's that amazing. But yes, I'm a Reiki healer. I'm a death midwife. I'm a funeral director.
You have hospital privileges.
Yes, hospital privileges at Providence St. John's, where I help the nurses on L&D and I'm on call for the obstetricians if there is a fetal demise or if there's some consult that they're needing. I've also taught the medical CEU equivalent to the OBGYN department on trauma and stillbirth, and even help them to recognize how to be more mindful, not only with themselves as doctors, because doctors that are a higher risk for suicide, they're an at-risk population. That's a whole nother discussion. Actually, a good podcast for you. But to also help them understand how do they go from one room where a woman, they just had to tell a woman she's, there's no heartbeat, to their next appointment, which she's having a healthy, fine pregnancy. And what do they do in between the transitions, and helping even doctors to become more mindful and use mindful. So I teach mindfulness as well.
I'm constantly blown away by the number of things that you can do and do so well.
Thank you.
And I think that it's not by accident too. Like you help women overcome infertility, and you get to be involved in their pregnancy and then their postpartum. And so there's the balance of the joy and the transformation, and then helping to guide them through death and transformation and loss back to joy.
Yes.
And you do it so skillfully.
Thank you. I know that when women come in really feeling low or just knocked down, I know that I'm going to help them get up off the floor and feel more confident and feel a little more empowered in their lives. But it's a process. They still have to be willing to do the work and show up at these appointments. And
it's a partnership.
A lot of them do. And the ones that really do thrive. And when they finally do get that happy ending, which we all want, of course, for these women and their families or their partners, their husbands, everybody involved, it's so satisfying. It's a very satisfying feeling. And
then there are the little satisfactions along the way, right? Like you wrap up a session, you can tell that they're leaving in a better state than when they arrived.
Right. Or they're in a more thoughtful place, or they're in a more, mindful place, certainly, grounded, and empowered, really, is what I like to help women feel.
And I think you do that by being so well networked and connected. You have your colleagues and you're supported by so many strong women, female friends. So, like you always are referring out, like that's probably another one of your strengths, is to not try to do fill all the roles of this woman.
That's impossible.
Right. So you expose women to other fields that's going to help them advance themselves along.
Absolutely. Any other modalities of healing? I love talking. I have my own podcast, as you know, and I love talking to healers. I'm really into helping women find alternative, supportive ways to help them physically, emotionally, in any capacity, and energetically and spiritually, in any way possible. As I know you do in your work, you help a lot of women spiritually.
Well, that's why we're here at Well People Together, kind of like
we're very like-minded in that way. But it takes a village to support women going through this, and it's wonderful to know of all the things, people out there also who are willing to support women on this journey. So yes, referrals are important.
Well, I remember when we ate lunch and you introduced me to the word catastrophizing. Like you didn't say, "Hey, Danica, let me teach you this word," but you just effortlessly give these verbs of what is going on. And it's really easy to catastrophize when you're on a fertility journey.
Mm-hmm.
So I want to lead us into fertility PTSD.
Yes.
Because I think it's not talked about enough, but definitely talked about more now.
Absolutely.
Like my domain is the emotions, and that's your domain too. So how does fertility PTSD look? How does it present?
Okay. So I'll just do a little background for a second. So historically, PTSD was really assigned to or diagnosed with war veterans, and not, people going through fertility or traumatic birth, or even experiencing someone they love that's died. No one really thought of these people as also suffering from trauma. They just called it grief, sadness, depression, anxiety. They kind of kept it to those adjectives, let's put it that way, those diagnoses, so to speak. And then as the body of research has come out, and as I've done my own work, even with groups and women, it's apparent that the trauma is also chronic for infertility patients, because it's not a one-time event. So it's not someone who's been in a car accident. It's not someone who's been, unfortunately, maybe violently assaulted or something that's a one-time, you get the idea, the one-time event, so to speak. It's a chronic series of, as if you're sending a soldier back into war. You keep telling him to keep fighting the fight and keep trying to get up that hill. And it seems like this hill is just impossible to get up. And they have to keep doing it. They have to keep showing up for these treatments, these surgeries, these hormone shots, without a sense of like, it's a done deal.
Like
there's no guarantee.
Completion. Yeah.
Well, there's no guarantee. So after they've had maybe, unfortunately, a failed IUI or even a transfer, the thought of having to go on all the medications again and having to figure out what's going on with them, it's traumatizing. It eats away at their self-esteem, their self-confidence, their sense of self, their sexuality, their identity as a woman in the world. And unlike a broken bone, like a broken arm or a broken leg, women tend to take the diagnosis of infertility as a sense of that they are fully defective as a whole, not as a part.
Mm-hmm.
They don't look at like, okay, my uterus or fallopian tubes or whatever else is going on needs support and help from a doctor. And it's something they need to show up to get diagnosis, whether it's a septum, fibroids, endo, or bigger, like they have to start going to immunologist or a hematologist, and get more information and blood work and things done to see what else is happening in their bodies. But they tend to globalize this diagnoses as a kind of an attack, a narcissistic attack, really, on them. It's a wound. It's a narcissistic wound to their identity. And if we can help women see that, look at all the other things that are working well in your body. It's not your uterus and your fallopian tubes do not define you in this world, and that they're diseased or something's going on that needs support and help around it, and trusting, hopefully, the doctors around them to, delve in and figure it all out for them.
Hard to trust other people when you're in a
absolutely
traumatized state.
Yes.
And when we're in a traumatized state, the hypothalamus isn't behaving properly. It might be sending confusing messages down to the ovaries because it feels like survival is threatened.
Absolutely. Nothing feels safe. They can't. That's a good point. And I agree completely that they have trouble trusting and knowing if that's why they turn to the internet, for example, like Dr. Google, and want to second guess, the doctor, and maybe self-diagnose. And that's part of the trauma. That's a symptom of trauma. They're trying to make sense of and gain control and agency over something that feels completely out of their control and disempowering. So they're turning to Dr. Google, their self-esteem, self-confidence, their sense of concentration and focus can show up as irritability and depression, anxiety, and they lose sleep or sleep too much. A lot of symptoms show up, and it's usually hyperarousal, and their hippocampus shrinks by 20 to 40% in trauma, which is where we retain new information and hold on to memory. So that will recover over time, but the hippocampus is also involved.
When that hippocampus is shrinking, it seems like that's akin with closed-mindedness, right? Because then they start isolating.
Right.
They start having the same repeated thoughts of it's happening easy for them, or like I'm broken or something. And the ability to think big picture, like if I can calm down, if I can take a step back, if I could be patient and give it 3 months to like heal, then so that's the hippocampus.
Yeah.
Interesting.
Yes. Also, the heart is involved in this. The heart can, one of the valves of the heart can enlarge during trauma, and it gives them, that's where the palpitations, panic attacks, anxiety, that's real. That's a real symptom.
Physiological.
Absolutely. And then, I always love your example of how the uterus is the second heart, and how we have to keep the heart feeling good and upbeat and hopeful, because if we're not good in the heart space, we're not going to be as good down here.
The uterine space.
Yeah.
Yeah. And the uterus in Chinese medicine pertains to ovarian function and the whole 9, Yeah.
So, diagrams, which I know you love to use, would be thoughts become beliefs, which become emotion.
Yeah.
And then that dictates your behavior, action, words, and choices in the world.
Yeah. And maybe even your outcome.
Right. And your outcome. So part of my job as a psychologist is to help people go backwards and go back to the brain and go, okay, sorry for this. In psychology, we call it distorted. I know some of the things that we call older women in gynecology isn't so positive either. But anyway, distorted beliefs, distorted thoughts. How can I help them move to neutral or positive in that area, and actually put it in black and white to help them at home with a journal? I actually give them a little journal, or if they already have one, great. I call it our little workbook, and we use that in the sessions, and they have to bring it to the sessions and take notes, or I give them homework or whatever. But the point of this is the mindfulness piece. And the mindfulness piece is, what are your thoughts? What are you thinking? And how are you feeling when you think these thoughts? And getting really curious with the feeling, and having them close their eyes and just center, and I ground them. And we work with emotions, and then we use color. I ask them to give that emotion a color and a shape. I'll just simplify it for the podcast. And then to put another color around that, and behind and around it, and to mix the two, and to watch in their mind's eye what happens, and let me know when the shape dissolves and when the color has completely mixed in and become the outer color. And the outer color represents their etheric body. So what I'm doing is empowering them by saying, you have it within you to heal and calm down your nervous system. You don't need something outside of you to help calm down your nervous system. But that's just a piece. There are things that outside do help, such as temperature, So there's something called sympathetic shock that women tend to go into, and they don't realize they're in sympathetic shock. And I help them learn to tune into knowing when they're in shock. And that will be numbing out, disassociating, having a sense of derealization, can't think, can't feel even. They can't even name a feeling. That's sympathetic shock.
Wow.
And teaching women how to treat their shock. They need to treat it with hot or cold. Usually temperature is the best. So ice, I tell them to go to the freezer, put ice on the back of their neck or their chest, or they hold it in their hands, or use heat with a heating pad, or drink something hot, or you take a hot shower. But that's how you treat shock. So even taking a ice pack to doctor's appointments, and having it ready if they need it in the exam room, and put it on them before the doctor comes in, so that helps them stay focused on the sensation of the cold, is keeping them grounded and present.
That's brilliant. Yeah, because so much trauma happens in those conversations, right? They receive so much bad news, they can't even look at the ultrasound machines.
Yes. I mean, that's a whole nother.
Yeah.
That could be a podcast.
That could be its own episode. So it's like using temperature and maybe putting the ice pack on the head, like in Chinese medicine, the thoughts go rushing up to the head. So
there are ice caps. For people who get migraines. So you can buy one off Amazon too.
That energy going upward. So what do you call that with respect to shock?
Treating it.
So just
treat your shock so that you're literally taking care of yourself so that you can remain present with what is or what's happening.
And so that's when there's like an acute thing that's happening and that's looking like shock. And then PTSD, that's like this chronic disappointments that feels like shock, but may not necessarily be shock, but it's just more like, oh God, here's more bad news. Here's more bad news.
Right.
And so then it's about integrating the trauma into the person as a whole.
Well, it's recognizing and separating out the trauma symptoms so that they can recognize that, oh, I'm irritable today because I'm exhausted and burned out from constantly worrying about my fertility and if I'm good enough, or being on that hamster wheel, as I call it, of woulda, coulda, shoulda, what if, only if, the Dr. Google stuff, the obsessive thinking to regain a sense of empowerment. So the sympathetic shock has more to do with past their thoughts, actually. It's really their thoughts and then the emotions that come up based on whether that's a discussion with a doctor or just they're alone and they're feeling isolated in this process.
They can feel panic attack coming on.
And how to treat that.
Right. Some of the most common panic attacks that I see in my patient population is when they're taking Lupron, which is shutting down, suppressing their ovaries, and then they're hot flashing because they have a reduced estrogen, right? So that ice pack on the chest or behind the neck would really be helpful.
Yes,
to the listeners.
Definitely.
So they're making notes.
Yes, for sure. Yeah.
So a few other suggestions as far as I just listen to your voice and I feel calmed, right? You have the right voice for the work that you do. So do you make meditations for your clients, or
I have recorded some, but I probably should.
As you're doing your hypnosis sessions with them, you could record that.
Yes.
Because the voice, that vibration and your intention behind it of calming, soothing. What are a couple other things that, so I'm getting kind of the sense of it's sensorial.
Well, when you're feeling, you're not thinking. So anything that helps a patient feel it's called thought stopping, actually. There's a word for it in cognitive behavioral therapy. So thought stopping can be a rubber band around their wrist and they snap it every time a thought comes up that's not serving them, like a repetitive this will never work out for me, or I'm defective, I'm broken, whatever negative thoughts are coming up. You can snap the rubber band and feel the sting of a rubber band, and that usually gets them to redirect.
And interestingly, that area is the heart protector channel, the pericardium. So a lot of the emotions are on the inner part of the wrist.
Interesting.
So snapping there is going to be a good reset.
Mm-hmm. Another one is just that I teach a tense breath, and that is for trauma, panic attacks. So the worst thing you can tell someone when they're having a panic attack is to relax and breathe. Mm-hmm. They need to tense and breathe. So putting their hands and fists, arms against the body, tighten the thighs and the butt. And if their core is okay, tighten the core. But if they're going through something, not to. And just to, as they breathe in through the nose, tight, 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 hold it, count to 8 or as long as they want, and then exhale through the mouth slowly and release all the tension at the same time. And you need to do that 6 times probably. And then when they open their eyes, they should feel a shift, which means they should be able to focus and concentrate better, see bigger picture, take in external stimuli better, and feel much more centered and grounded, and not so panicky and flighty. Mm-hmm. So again, the feeling into the body,
getting in the body again,
is really helpful. Mm-hmm. I do something with patients called purification of the visual field. That's a mindfulness technique where you take flashbacks and help totally soften the emotional response to a flashback.
Please, how do you do that?
So what you do is, let's say the ultrasound machine is a big one. I have them take a picture of the ultrasound machine in their mind's eye, like a snapshot of a photograph, and place it on water. And their eyes are closed. After I've grounded them, had them look around the room to tell it's not silly to tell the amygdala that they're safe. And it's okay to close the eyes. So they close their eyes, and then have them imagine this ultrasound machine. I have them place it on water and push it under the water and watch the photograph start to sink more into the water, and let the ripples of the water, just as if someone dove into a swimming pool, and have them watch the ripple effect of the photograph go wavy, back and forth, back and forth, back and forth. It's wavy. And then it sinks a little farther. It goes wavy. You can kind of make it out, but you kind of can't. You can kind of see it, but then it's gone. And it just let the water absorb all the emotion of that moment, and let the photograph sink a little further, and let the water go wavy, and let it go further, and let me know when you can't see it anymore. And it completely softens and takes away the emotional charge of that moment of an ultrasound machine, for example.
Good. Yeah. Especially with your voice.
I spoke about this at the Stillbirth Summit at Surrogacy in Minnesota before COVID. I talked about stillbirth and mindfulness, and how mindfulness can help grief.
What do you think you see the most of right now? What group are you serving the most? Or is it just such a smattering of everything?
Wow. A lot of terminations for medical reasons. Miscarriage, infertility, gestational surrogates. A lot of gestational surrogates too right now going on.
Mm-hmm. Mm-hmm. So let's talk about that then. You have the intended mother as your client. Mm-hmm. How do you prepare her? So you're helping her make the decision, or you're helping her integrate the potential perceived trauma of using a carrier to carry a child?
It's all of it. Helping them through the process of choosing, mm-hmm. and what that's like, and mm-hmm. the guilt that comes up for them, and how if they want to be the ones carrying. They don't want someone else carrying the baby.
Yeah.
And the lack of control they feel. They want to know what they're eating and drinking, and if they have cats, or if they, if they eat fast food, or what if their kids bring home illnesses and they get sick too, or they don't live close by, or they're even out of state.
Or what they might be exposing their unborn baby to in their work stress or relationship stress.
So I was, I counsel them. I say it's good to have a gestational surrogate that's married or in a committed relationship, so they're not having sex while they're pregnant with your baby. Most of the times they have kids, so they're busy with that. But there's not a lot they can control for, and it also depends on who they pick as a surrogate and how much that surrogate is willing to talk to them, calm their fears, be involved. Or some surrogates don't want that many phone calls. They only want to talk 3 times a week, don't want them at appointments, or are totally open and lovely about the whole thing and understand the woman is anxious and can help calm them by the conversations. But a lot of the women that go through with this, it really just pouring salt on the wound in many ways. It's like they really wanted to be the one to bring this baby into the world.
What's a couple examples of ways you help them to feel okay with the choice that they had to make?
I honestly, you just have to listen and empathize and not disempower you can't take away someone the way they feel, but you can support the way they feel and just say, I know you wish it was you. It's sad that it can't be you, but it is your just genetic material, and you are the mother of this baby, even though you couldn't be the vessel or the person to birth this child.
And then helping with the PTSD of them being triggered. So do you think Marley Steinman was on the pod, and she said that when she sees them start to get excited about planning a nursery or creating a registry, something like that, then that's how she sees that they're coming online and coming out of trauma, and they're shifting into readiness.
Right.
Sort of. What kind of things do you see when they're integrating the perceived trauma of somebody else is going to carry my baby?
Well,
or let's not limit it to surrogacy, but let's say they've got to make the decision to use another woman's egg or another man's sperm to make their baby. And so that's falling under the category of, this is not how I wanted it to be. So that's traumatizing.
Right.
So
it's a loss of a dream, a lot of grief,
grieving. So you move them through like a grief work kind of.
A lot of grieving, a lot of them knowing ultimately this is their baby, though, that they get to bring it home. They get to bring it up, like nurture it and love it and care for it and be its mother. And that just because they didn't birth it doesn't mean they're not a mother. And that they are very much a mother to this baby. Yeah. Regardless of how it gets here. It's because you wanted a baby so much, and to love a baby and a child and create family, and that it's out of love that you're having to make these decisions.
Yeah. I would imagine it's pretty conflicted, right? We have a patient we worked with together who had uterine factor, severe adenomyosis. And to know that the surrogate conceived obviously made her happy they're going to get a baby, but it was also like, dang, because she ended up getting pregnant around the same time and then had another miscarriage despite having surgery. So it was like, dang, that just should not have happened. It's so sad and unfair. So it's like I think at some point she will turn the corner and be in this ready to receive the baby as it becomes more and more real and farther away from the pregnancy demise that she had. It's just some of the way that I work with the patients is to talk about evolution, infertility as a part of evolution. And that's one way of helping them to kind of normalize, if you will, some of these catastrophes and broken dreams. It's kind of like, this is what's happening. And so, because having been in the field as long as we have, like together, we have 50 years of experience in loss and when it doesn't work how they want.
Or more.
Yeah, right. But for both of us, we are both moms, and we have the experience that when I look at Kira and Jack, I don't think, oh, I love you because you have my DNA, or I don't love you because you came through my womb. They are relationships that I have with these two people who have their own agenda, their own spirit, soul. You know, it's a spiritual contract, if you will.
Exactly.
So that kind of helps them to get their head around the idea. I mean, it isn't fun. Nobody would actively choose, hey, it's to have that be their path. But our role is to move them into acceptance of what's happened so they can get to the joy.
Oh, absolutely. And going back to that patient we're talking about, she's actually taking a regimen of pills to lactate.
Amazing.
She wants to breastfeed this baby, even though the gestational carrier will birth it. She is going to try to breastfeed.
Good for her.
Yeah.
That's going to, I mean, with the oxytocin that comes from the prolactin and the milk and the whole nine.
Yeah.
And that's good for her.
Fingers double crossed.
Yeah.
On that. Yeah. I hooked her up with Jennifer Davidson, who's an amazing lactation consultant here in Los Angeles.
You are so well connected. I think anybody who works with you, like professionally or as a client who's working with you, they benefit so much from your years, decades of meeting and knowing and vetting and trusting and
no doubt
watching all of that. So we really can make it as good as it can be.
Yeah.
I think a good segue into I think the next thing we should talk about is the role you play in postpartum. Can you elaborate?
Yes. Okay. So postpartum is a misnomer. Postpartum can happen during pregnancy. It's called perinatal depression and anxiety. So it's not something that just happens after a baby's born. Anything post 2 weeks after a baby's born as well is a postpartum mood and anxiety disorder, as it's called now. I'll just call it postpartum depression for ease of wording on this recording. So it hides in plain sight. You know, here are women who mostly, I would say for the most part, these are wanted babies. They wanted to get pregnant. They wanted to have a baby and realize they're not so happy. They're like, wait a minute, this is like a lot more work. I'm tired. I can't focus, concentrate. I can't attune. They worry they're bad mothers. They're not good enough mothers. A lot of anxiety comes up for them after a baby's born. Everyone around them is so happy for them. And wow, you have a baby. Oh, look at how cute the baby is. And they're sitting there secretly going, oh my God, I think I made a mistake. I can't believe I did this, you know. And so a lot of guilt comes in, obviously, a lot of fear and guilt about, did they make a wrong choice after all these years of trying and wanting this baby? And so hopefully they're recognizing that they're in distress and need support and help and counseling. A lot of women don't think postpartum is going to happen to them.
A lot of women don't want to mention anything because they spent so much money on in vitro to become moms.
There's a lot of guilt about that. So they look better than they feel. especially for pediatrician appointments, they'll like put some makeup on, put themselves together, put the baby in a really cute outfit and go off to the pediatrician and act like everything's fine. Hopefully, because mostly on East Coast, West Coast doctors these days, the nursing staff tends to inquire with the mother more, how she's doing, how's the breastfeeding going, if they're breastfeeding, any challenges. You know, they tend to ask some questions to see if they can pick up anything that the mother might need support around. But for the most part, a lot of women, you know, are having babies later in life, and they're self-sufficient, go-getters, can solve things on their own. And a baby just throws a wrench in everything. And it's a whole, you know, earth-shattering experience and a steep learning curve to have a baby later in life, when you've gotten so used to your routine and your quiet time or your ability to work that 12-hour day. And, you know, and they realize quickly, oh my gosh, I don't know how I'm going to work again, or how I'm going to be able to show up for work and also meet the needs of this baby. And there's a lot of spiritual reckoning that happens when a baby does appear.
Changes everything.
Yeah, forever.
In Chinese medicine, we see the postpartum era as a spectrum of blood to essence depletion. And with the depletion comes heat. And so like a simple blood deficiency is not going to look as extreme as a essence depletion with heat that turns to fire. So over here, heat, fire, essence deficiency is like hallucinating, completely irrational thinking, whereby a blood deficiency is like dryness, like lusterless skin, trouble sleeping, weird dreams. Like it's this spectrum. And we nourish them with herbs or make the recommendation for placenta. I'm sure that's something that you support or you see some of your, but with these women, the more that they were already blood or essence depleted and a mixture of heat before they conceived, once they then go through the gestation, and they've had this effulgence of all these hormones, then there's the old constitution again. And so the more that we help them on the front end to reconcile nutrient deficiencies or depression, those kinds of things that they're dealing with or not dealing with, the emotions, like the more we work on that, then after the baby, then hopefully there's a little bit less postpartum, but it is still tolling and taxing on the woman's body to grow a human being.
Absolutely. Absolutely.
Then we have what we've had recently, what we saw in 2023, the babies that were full term at week 37. Remember, you and I, we had a couple of them that came out on the same day. Your birthday, even.
Yeah. Oh gosh, that's right. Yeah.
So we're seeing that in terms of evolution, babies being ready at like 37 and 38 weeks, and they pass all the APGAR scores, and developmentally they're complete. And we are really seeing the full gamut, you know, but maternal mental health. So you work with new moms, and once postpartum depression is ruled out, then you're helping them with
transition to motherhood.
Exactly.
Yeah. And how well they can handle stress and pivot so that they can balance the work mother load and what that encompasses for them.
Yeah. Is there anything else that you would want to share from a wise woman perspective, just a pearl of wisdom or something as you get this opportunity to speak to this audience, whoever is out there listening?
Self-care is not an option. It's a necessity.
You say that to me a lot.
I say,
well,
I'm big on self-care. That's like a huge thing. That's a big part of my work.
I don't see how you could do your work if you weren't so big into self-care.
You have to. I have to walk my talk.
Yeah.
But yeah, self-care is very important. Advocating for yourself, learning acronyms, learning about what's going on with your fertility process, and being proactive in the meetings with your doctors. Take notes, bring, your partner, husband, friend with you to also help, hear everything that the doctor is sharing. But really be an advocate. Don't go crazy on Dr. Google, but certainly, look things up and know what's going on with yourself and your body, and not to be afraid, but to be a part of it. And that will feel much more empowering to you than going into a doctor's appointment and just kind of checking out and just trusting that the doctor knows what they're doing. And that's just not the case. There are many doctors who miss a lot of things, and to be actively listening and following along with what's going on.
Yeah, it's like you're saying, trust yourself and love yourself and be kind to yourself, right? This process, I don't see it just picking a few people. Like, I think this is where evolution is heading, that it's going to be that we need technology, or we need villages, and we need perspective changes. So if that's the case, to embrace that versus like fighting it and then shaming yourself.
Right. Beating yourself up. And I always say, talk to yourself as you would a friend. If you're saying something unkind to yourself, you have to inquire why. Where's that coming from? Did someone else speak to you like that in the past? And to cancel that out and reword it so that it's a much more self-compassionate statement towards the self. And patience is absolutely necessary for fertility or infertility diagnoses, that it's not a quick, you're not going to, it's not a sprint, it's a marathon. And that to remind yourself that self-care will get you there.